Psychedelic medicines in general create an opportunity for self-awareness, for self-compassion, to learn about oneself so that we can choose differently and design a life that's in line with who we truly are.
I worked previously in a trauma and neurosurgery department in downtown Toronto. I saw a lot of clients who attempted to commit suicide, and they were even on traditional therapies such as antidepressants and therapy. And I often found that even though we would help them, treat them, they would come back with repeated suicide attempts. So I noticed that for some, antidepressants may work, but for others, not always. And I really wanted to find something that was going to help people that were searching for alternative therapies.
Ketamine is the poster child for a paradigm shift in how we think about treating depression. It's been looked at for well over 20 years in terms of treating psychiatric disorders. People focused a lot on serotonin, norepinephrine. We have the Prozac generation and drugs before and after where that was part of the mechanism. And yet about a third of our patients didn't respond. So ketamine comes along, it works through different transmitter systems in the brain, and it seems to work much more rapidly than the traditional treatments.
The combination of ketamine and therapy together is extremely synergistic, and what we're hoping to do is, through 5 or 6 sessions of this drug plus therapy, do what would take maybe months or even years with just therapy alone. So we're supercharging therapy by using ketamine to open the mind, to go deeper, faster, and quicker, to alleviate substantial suffering such as suicidality or severe depression very quickly.
Field Trip is actually taking a bold step in terms of looking at the combination of psychotherapy with ketamine. We also know that there's a history of psychotherapy and people being more open to change with generally low doses of mind-altering substances, ketamine being a mild psychedelic, if you like. So I think it is, and there's a limited but a fairly good evidence base that the combination works.
Before clients come in for their ketamine-assisted psychotherapy sessions, we do a psychological assessment to assess their readiness for our treatment program.
We want patients when they walk in to feel relaxed, calm, and we actually want to encourage them to feel like they've entered a different space. And that kind of sets the tone for the ketamine therapy, because the ketamine is going to push them into a different mind space. What we do here at Field Trip is we specifically combine sublingual lozenges, which kick in rather rapidly and produce about an hour of effects, and then we pair that with psychotherapy. We strongly believe that when you're trying to help someone with significant depression, it's extremely important not to just give the drug, which is a biomedical approach, but rather also pair that with psychotherapy, so you have the biomedical psychosocial approach, which is a much more therapeutic one.
I think we've established over the last 2 decades that many people say, when I take a medication, I'm more enabled to make use of a psychotherapy. And I think this is an extension of that thinking. So I think there'll become a coming together of those who are in the psychotherapy world and those who are in the medication world.
So ketamine is an interesting psychedelic because the experience is different every single time. More milder levels, it can produce feelings of relaxation, reduce feelings of anxiety, create an opening really for the therapeutic work that's to follow, and what we feel is a real benefit of this program. Psychedelics have an incredible healing potential because it allows clients to connect with themselves, connect with other people, connect with the earth, connect with a greater beyond. And I think that's the healing transformation that happens in these walls, at our clinic, and through psychedelics.
We put eye shades on their eyes to have them look inward, and we put headphones on their ears to help support the experience with synergistic music. And we have a therapist in the room the entire time. And then after that hour session or drug experience, we sit down and we try to understand what it is that came to light that produces meaning in their life. And then with integration sessions, what we try to understand is how can we take these ketamine-assisted psychotherapy experiences and integrate it into your day-to-day life so that your patterns are changing every day, your behaviors are changing every day, so that the life that you lead is more meaningful. The current philosophy is treating symptoms, and what we're trying to get at with psychedelic-assisted therapy is helping individuals heal. And no one is a better healer than the individual themselves. So physicians, therapists, we're merely just conduits for patients to open their mind and see the path that each of them individually needs to do to go forward in their own healing journey.
We encourage self-care following this program. This is one part of a larger journey that happens over the course of a person's life.